All right. Good afternoon, everyone. We are so glad to have you with us. My name is Angela Birch-Ocketree. I am with the Early Learning team at the Hunt Institute. For the benefit of anyone who may be joining us for the first time, the Hunt Institute is the creation of our founder and namesake, four-term North Carolina Governor James Hunt. We serve as an education policy support for governors, state legislators, and other high-level state elected leaders. We cover the full spectrum of education policy from prenatal and early childhood through college and career. In our Early Efforts webinar series, we focus on the prenatal and early childhood portion of this continuum. Before we begin, I want to go over a few quick housekeeping items. Later in the hour, we will share some of your questions with the panel. If you would like to contribute a question, please use the Q&A function in the Zoom bar at the bottom or top of your screen. Also, please know that today's session is closed captioned and you can access those settings in your Zoom toolbar as well. Finally, this session is being recorded and you'll be able to find the recording on the Hunt Institute's YouTube channel in just a few days. Just go to YouTube, search for the Hunt Institute. You will also receive a post-webinar email with a link to the recording and some follow-up resources. Excuse me. So on to today's topic. In the 2022-2023 school year, over 446,000 children aged 3 and under were identified as experiencing homelessness. This is an increase of over 82,000 or 18% from the 21-22 school year, illustrating that homelessness during early childhood is a growing crisis. Early childhood homelessness can significantly impact a child's health, development, and long-term well-being, which underscores the need for policymakers and community members to focus on this critical priority. This webinar will explore the initiatives, policies, and solutions to early childhood homelessness, particularly exploring how organizations are working to address this crisis. We will also explore how early childhood homelessness affects child growth and development, and how addressing homelessness in early childhood is part of holistically addressing early care and learning. I'm so pleased to welcome our panelists today. We have Sarah Vrabik, Senior Manager of Early Childhood at Schoolhouse Connection, and Carrie Byers, Managing Director of Illinois Policy at Start Early. Welcome to you both. We're going to jump right in. My first question is for Sarah. Sarah, given the statistics mentioned just a moment ago, what key factors are driving that sharp rise in early childhood homelessness? And what does your team's new report, which covers all 50 states, reveal about regional differences?
Wonderful. Thank you so much, Angela. And hi, everyone. It's great to be here with you all today. This is a fantastic question. And before I dive in to my response, I first want to quickly orient to Schoolhouse Connection's mission and work. So we are a national nonprofit advocacy organization working to overcome homelessness through early care and education from prenatal through post-secondary. And we go about this work in several different ways. We work with state and local educational agencies, early childhood providers, and other institutions of education to help them understand not only the legal requirements for identifying and enrolling children experiencing homelessness, but also the best practices for doing so. We also advocate at the federal and state levels for policies that remove barriers so that children, youth, and families experiencing homelessness can have greater access to education. And we like to say that the jewel in our crown is our network of young scholars. These are scholars who have experienced homelessness themselves, and we are privileged to support them through not only financial scholarship, but also case management services as they pursue their post-secondary education. So I encourage you to visit our website, schoolhouseconnection.org, to learn more about our work. I'm the senior manager of early childhood at Schoolhouse, and our early childhood work is centered on increasing the identification of young children experiencing homelessness and also supporting early childhood programs and systems so that they are better able to mitigate the impacts of homelessness on young children. So I'm thrilled to be with you all today to have this conversation. And in the lead up to our discussion, Angela just mentioned some data. That data is actually from our most recent data report on infant and toddler homelessness across 50 states. So Schoolhouse has partnered with Poverty Solutions at the University of Michigan for the past 3 years to develop this estimate of the prevalence of infants and toddlers experiencing homelessness across the US, as well as their enrollment rates in early childhood development programs. I believe we can put a link to that report in the chat, and I'll be referencing the data and the recommendations found within that report throughout our conversation today. But getting back to the first question, when we're thinking about key factors that drive family homelessness, there are quite a few. And one of those key factors is that we actually have 2 different federal definitions of homelessness in the United States. The biggest difference between these 2 definitions is who is actually counted as homeless and therefore able to access housing services. So the Department of Housing and Urban Development, their definition is more narrow, and they're only counting those who are staying in shelter or who are visibly unsheltered. So you must be in one of those situations in order to qualify for HUD-funded services. And so this excludes many families with young children who are experiencing homelessness. The McKinney-Vento Homeless Assistance Act, which is the Department of Education's definition, defines homelessness more broadly. It does include those who are staying in shelters and who are visibly unsheltered, but also those families who are staying in cars, who might be staying in motels or hotels, and importantly, those who are sharing the housing of others or living doubled up. And it's families with really young children who are more likely to experience homelessness in those last 2 categories. These families are less likely than single adults to stay on the streets and other outdoor locations where they could possibly be included in point-in-time counts. But it's important to say that the situations that they do find themselves in can be just as unsafe, just as unstable, and sometimes may even be more precarious. It can look like the only option at night being a mom sleeping on the couch with her infant, and so therefore that family is not able to adhere to safe sleep practices. It can certainly look like staying in overcrowded environments, children constantly being shushed because if they make too much noise, the family may be kicked out of that living situation. So just imagine a toddler trying to develop in an environment where they have to constantly be quiet and there is no room to learn to crawl or to play with their siblings. And so these kinds of hidden homelessness that are included in the ED definition, but they're not included in the HUD definition. So these families are then left out of a lot of those federal housing support services. And by aligning these definitions at the federal level to the McKinney-Vento definition, more children and families will then be counted and served. Another key factor that drives this increase is, as I'm sure everyone on this call is aware, the dramatic increase that has happened in the cost of housing and the cost of living. A new report from the National Low-Income Housing Coalition shows us that only 1 in 4 families that qualify for housing assistance actually receive it, and that the US is facing a shortage of 7.1 million affordable and available rental homes. The affordable housing just simply does not exist. And we also know from research out of the eviction lab at Princeton University that the age group at the greatest risk of eviction in the United States is actually babies. You are most likely to be evicted in this country and seeking housing support services as a baby. And actually, if you are a family with young children, you are twice as likely to be evicted than if you do not have young children. And so these are just a few of those reasons that we are seeing this increase, the significant increase in homelessness among families with young children. And getting back to the other part of the question about, if there are regional differences, in our analysis, we found an increase in infant and toddler homelessness in 48 states, including DC. And so this issue is not merely concentrated in a few different areas of the country. It is an issue that is prevalent across the nation, and therefore it demands national attention. And I think that will flow us nicely into the next part of our question about the urgency of this issue.
Absolutely. Thank you, Sarah. Yeah, even what you just mentioned, the different definitions that exist and how that can impact, how families are viewed, maybe what resources are available. Carrie, public understanding of early childhood homelessness is often limited, and that's a great example. How can we better communicate the urgency of this issue to build public and political will for change?
Thank you, Angela, for the question, and thank you for having me here today. A few things come to mind for me, and I'll sort of stay on this topic of data. I think this is a huge area that we need to focus on improving the data and research that's available on this population. The work that Schoolhouse Connection and others are doing in this area to put out better national and state estimates of the prevalence of homelessness among children under 5 and their families is really crucial to kind of understanding the big picture scope of the issue, and we need to do a lot more of that kind of work. But we also need to drastically improve the data collection and reporting just within the programs that serve this population so we can better understand the service gap. So this means ensuring that in all of our early childhood programs, we're collecting data on homeless status in a more uniform, consistent, and aligned way. And it has to go beyond just making sure that there is a data collection requirement to begin with. We also have to consider providing the appropriate training and support to the staff who are charged with identifying the families as experiencing homelessness and reporting that data. We only have good data if the families are being identified appropriately. Data literacy, I think, is another thing we need to consider here, especially among our system leaders and decision makers. Given what Sarah just shared, about the different definitions of homelessness, I think we have a lot of work to do to help people understand and interpret the data that they are looking at. For example, we know that annually communities are charged with doing what's called the point in time count. So there's this kind of one on a single day, how many people in your community are experiencing homelessness. And I don't know how many times, I've gone to work with a leader and they've looked up data and this is the number that they found, and they'll say, okay, but there's not very many children and families here. And so I think that just underscores why we need people to better understand those different definitions and different data sources. The second thing I think we can do to build more public awareness is to invest in public education and awareness campaigns to amplify the kind of data that Sarah shared in a variety of ways that will be digestible and meaningful to a lot of different audiences. And this is where I think we also have an opportunity to bring together our kind of small but growing community of stakeholders who care deeply about this intersection of homelessness and early childhood to better align on strategic messaging so that we can kind of broaden and deepen our impact. And then lastly, I wanted to say that I think it's important that we're developing and promoting leadership among people with lived experience, and specifically caregivers for very young children, so we can really amplify their voices. I think we find that even in spaces where, we do have leadership from people with lived experience of homelessness, most of the time, those are not people who are currently or recently pregnant or parenting very young children. Families with young children often have so many competing demands, and so we have to provide a lot of supports to enable them to step into these types of leadership roles. And then I think just in general, the importance of building champions among system leaders, legislators, and other stakeholders who sort of have those bigger platforms and influence and really the trust and ear of their communities, to better understand this issue so that they can speak up and speak out.
Wonderful. Thank you, Carrie. Yeah, great. Raise awareness, raise the advocates, the stakeholders, and push for that change. Absolutely needed. The voice of lived experience really important across all areas, but I can't imagine a policymaker looking at a family with a young child experiencing homelessness and not feeling the need to take action. Thank you for that. Sarah, given that early childhood homelessness isn't just housing instability, but also intersects with early care and learning, how can addressing homelessness in this age group be better integrated into broader early childhood systems to improve long-term developmental outcomes?
Thank you. This is a great question. So I'll start by just giving a little bit of context. So it's important to note that for decades, national homelessness policy has been really focused on visibly unsheltered homeless adults. And those adults absolutely have urgent needs, but the focus on chronically homeless adults has eclipsed any focus on young children, despite the fact that we know that the younger and longer a child experiences homelessness, the greater the cumulative toll of negative health and life outcomes, as well as they are more likely to then experience homelessness later in life as an adult. We also know we have significant evidence that when a young child who is experiencing homelessness is able to regularly attend early childhood development programs, that participation and attendance actually mitigates those negative developmental outcomes that may be caused by homelessness and helps keep that child on a path of healthy development. But of course, children can only benefit from those programs if they're able to access those programs. And so we referenced the data earlier. We found nearly 450,000 babies experiencing homelessness across the country. But we also found that only 10% of those infants and toddlers were enrolled in an early childhood program. And that was early Head Start enrollment, and some home visiting models, as well as those who were identified and served through an LEA affiliated program. So when we're thinking about integrating these broader early childhood systems to improve long-term developmental outcomes, a really great first step is to adhere to those existing requirements that are on these systems to prioritize this population. So I'm thinking about early Head Start and Head Start programs. Children experiencing homelessness are categorically eligible for these programs, and these programs are charged with removing barriers to access for families experiencing homelessness by providing grace periods for the submission of usually necessary enrollment documentation. These programs are also allowed to reserve up to 3% of their slots for children experiencing homelessness, meaning at any given time there could be a slot available immediately for a child identified as experiencing homelessness. At Schoolhouse, we do a lot of workshops and trainings across the country, and I can tell you that there are many programs who are not yet taking advantage of that opportunity to reserve slots. So anytime we have this conversation, I highly encourage those in this arena to be asking that question of programs and encouraging them to reserve those slots. Early intervention, states must make early intervention services available to infants and toddlers experiencing homelessness. And if you do have HUD-funded shelters within your community, those programs are required to have a staff person who ensures that the young children in their care are accessing early childhood development programs. Carrie just mentioned the importance of accurate data collection and reporting. So those McKinney-Vento homeless liaisons within your K-12 system, they are also required to identify and refer young children experiencing homelessness to early childhood programs. So when we're thinking about these systems that interact with young children, the K-12 McKinney-Vento homeless liaisons are also charged with identifying this population. So that is a great connection to make among these early childhood systems. And then one other point I'll mention is many childcare programs actually do endorse certain prioritizations for young children experiencing homelessness. And in our data report, we did individual state profiles. So I encourage everyone on the call to explore the report and check out your state profile, because not only does it identify the estimate of infants and toddlers experiencing homelessness in your state and their enrollment rates, but also whether or not your state endorses those prioritizations for children experiencing homelessness accessing childcare. Examples include waiving co-payments for caregivers, waiving those proof of income requirements, and all of these remove those barriers to access so children can start receiving services as quickly as possible. And if you're looking for a good starting point for advocacy, that is a great place to start. See what your state endorses, and if you don't like what you see, you can start advocating for that state change. And then one other point I'll make is how critically important it is for there to be cross-system collaboration to better serve this population. When we think about wanting to improve those long-term developmental outcomes, all of these systems that I mentioned, they interact with young children experiencing homelessness and their families. They are responsible for their care and their education, but often these systems are so siloed, and that is really at the detriment not only to the system itself, but to the family, because then more burden is placed on the family to navigate these systems while they are already experiencing homelessness and trying to raise a young child. So I just want to echo everything that Carrie mentioned. Cross-system collaboration is critical, as well as elevating the perspectives and experience of families with lived experience, particularly if your program or your system is wanting to improve policies and practices. Make sure that caregivers with lived experience have a seat at the table, because they know exactly what it's like to navigate these systems in your state, in your local communities, and I'm quite sure they have ideas for areas of improvement. So thank you.
Thank you, Sarah. Yeah, interesting about the state endorsements and being able to check out what's available in your state. Seems like a fairly easy next step for a state, maybe looking to improve the situation for children and families and experiences. It's something that has already built precedent in other states, perhaps, and so that would maybe an easy lever to pull for the advocates who want to get involved. So, Carrie, Sarah mentioned a few barriers that can prevent young children from getting those services. What are other barriers that could prevent families with very young children from accessing that early care and learning? And how is your organization working to overcome those obstacles?
Thank you for the question. And yeah, you're right. Unfortunately, there are many barriers to early care and education programs for families experiencing homelessness. And some of that is associated with the tremendous barriers that homelessness can create to lots of different programs and services, not just early childhood, things like high mobility, increased acute and chronic health problems, and families just having competing priorities. If a family's living just a very chaotic life at the moment, enrolling a child in an early childhood program might not be their most urgent need, so that's not what they're going to prioritize on a day-to-day basis. Trust, I think, is also a huge issue for families. We're asking families to entrust their children to people that they don't know. And in our early childhood programs, we often ask a lot of very personal and intrusive questions right at the point of application. Obviously, some of that is about, determining if a family is eligible, but it's still a lot of personal information to share with someone that you don't know very well. And in talking with caregivers in Illinois, what we hear a lot about is those past negative experiences that people have had with all types of social service providers and services, and that can make it difficult for them to want to take a chance on trusting an early childhood program. And then the other thing is just we hear a lot about fear of being reported to Child Protective Services if early childhood programs find out you are experiencing homelessness, which of course is not supposed to happen, but we know that, it does. And of course, the fear is very real, regardless of, whether it's happening or not. We also find that just our program eligibility requirements, our enrollment processes, participation requirements can pose major barriers as well. Sometimes programs can have pretty rigid enrollment and attendance requirements or have these like multi-step complicated enrollment procedures that are hard to navigate. A lot of families lack required documentation, like those health records and birth certificates. And even when there are policies in place to provide the grace periods to families for producing those documents, which there should be in most programs. And Sarah, mentioned that, of course, with our early Head Start programs. We still find that families and even some providers aren't always aware of those exceptions that can be made. And then they're just deterred from even trying to enroll in the first place. Obviously cost is a major factor too. Just the availability of free and low cost early childhood programs like Early Head Start and Head Start or pre-K program, that's often very limited. And without a childcare subsidy, we know that, most childcare programs are just, the cost is astronomical. It can cost more than your rent, and that's especially true for infant and toddler care. Many families experiencing homelessness struggle to meet the eligibility requirements for childcare subsidies, as homelessness can make it difficult to find and keep employment or to maintain enrollment in an education or training program. And something we hear a lot about from families is that there's this need to have the stable childcare in order to pursue your stable employment and housing, but unfortunately they kind of can't access the childcare assistance until they have the employment. So there's this kind of, sort of circular problem. I'd probably be remiss if I didn't mention just that in general, the ECE system is highly complex and honestly difficult for nearly everyone to navigate. It's under-resourced. We, just don't have enough slots available to meet the needs of families, especially when it comes to like having a program in a location that's accessible to you, the hours that you need, or, programs just offering the types of trauma-informed supports that children may need. So in terms of what we're doing about these problems, first and foremost, our Start Early policy team, works alongside advocate partners to increase state and federal investments in the full range of ECE programs, and that includes Head Start, childcare, pre-K, home visiting, and our IDEA Part C early intervention programs, so that our state can continue to expand eligibility for the programs and expand availability of the program, so adding more slots. Illinois is also in the process of standing up a new early childhood state agency and will be migrating early childhood programs that currently live across 3 state agencies into this new one. As advocates, we are, of course, contributing to statewide efforts to reimagine and redesign our ECE system, and that includes, making the system just simpler and easier for families to access and navigate. And we really see this as an opportunity to really center the needs and desires of families who face the most barriers, like families experiencing homelessness in those efforts. Start Early is a longtime Head Start recipient. So, we have a lot of experience serving children experiencing homelessness. So that's sort of something that we're leveraging in our advocacy so that we can lift up both policy and programmatic recommendations to our new state agency. Our policy team also works in partnership with state agencies to identify and change policies that pose barriers or to enact new policies that promote enrollment of children experiencing homelessness. So for example, we worked with our child care lead agency, which is currently the Department of Human Services, to establish a policy where families experiencing homelessness can apply for our child care assistance program, and they'll be approved for 12 months of care with a waived copayment, which is something Sarah mentioned, and they have 6 months to submit documentation for an eligible activity like employment. So this was, specifically proposed to address that issue I mentioned earlier of families needing the safe and stable care first in order to address their housing and consistent employment or education. And then something else Sarah mentioned was kind of that cross-sector partnerships. I think that's something else we've been doing a lot more intentionally so that we can address the barriers to housing and services for this population, and really work to pursue more kind of innovative out-of-the-box approaches that extend sort of outside of our early childhood lane as we've defined it. Last year, we partnered with the Chicago Coalition to End Homelessness and the University of Illinois at Chicago Center for Research on Women and Gender, that is a mouthful, to convene a group of expert stakeholders across maternal and child health, early childhood, and housing, and including people with lived experience to develop a 10-year action plan for preventing and ending homelessness among pregnant people and families with infants and toddlers in Illinois. And so our plan identified sort of these 3 core focus areas. One is expanding access to housing, including affordable housing and enhancing traditional homelessness and shelter programs so that they can be more responsive to and accessible for families with very young children, as well as, again, more out of the box thinking about how do we leverage new and alternative funding sources. The second is improving services and supports, especially around coordinating and integrating services, expanding direct cash assistance approaches and access to public benefits, and more emphasis in general on prevention services. So things like credit repair, having flexible funds available to pay for utility arrears or move-in fees, and specific supports for eviction prevention. And then the last one is strengthening the workforce and professional practice. And that includes better training and professional development across sectors that focuses on this population specifically. And that includes improvements for mandated reporter training, thinking about strengthening service delivery approaches across sectors to be more trauma informed, and just reflective of best practices in working with families with young children. And I'll say this was a recurring theme in all of our engagement with parent leaders on the project. They were very clear that the problem wasn't just with the kinds of help that they were being offered, but with the skills, abilities, and unfortunately attitudes at times of the professionals that were providing the help. So those are things that we hope to address in the coming years. We're continuing our work in partnership with the Chicago Coalition to End Homelessness. And actually, this month, we'll be kicking off the second phase of our project, and we're going to start the implementation of our action plan. So we're really excited about that. We're going to start maybe a little bit small, though, because you can imagine those are three like very huge focus areas. And so we're going to start with just building out a data dashboard for Illinois. So again, to create that shared understanding of how many children, who are they, where are they? Some efforts to just raise awareness of homelessness among the prenatal to 3 population in our state. And then we'll begin developing plans for several pilot projects to operationalize some of those ideas I mentioned earlier. So really excited to think about, how can we embed legal and housing supports into a home visiting program? How can we add direct cash assistance onto a health program? Things like that. So I think we're really hopeful that this kind of continued work with our cross-sector partners is going to allow us to build those stronger cross-sector partnerships across the state, increase awareness and knowledge, and be able to identify and advance some really kind of specific projects that we think will make an impact.
Great, amazing. Thank you, Carrie. Yeah, I know Secretary Teresa Ramos is doing great work in Illinois, bringing together that consolidated early childhood department, and hopefully that will help, streamline some services. But again, the early childhood system is complex for everyone, including those who have worked in it for many years. I can't imagine trying to integrate systems that work for early childhood as well as children and families experiencing homelessness. We look at both of those populations and they are consistently under-resourced. You talked about professional development and the folks that are dealing with these, interacting and helping and hoping to support these families, and just the resources that they have at their disposal. I know most specifically about early childhood educators and their wages and the challenges that they go through. So really supporting and uplifting these fields as a whole is beneficial for everyone. And then to the things you mentioned, like taking care of credit reporting issues, utility payments, those concrete supports. People might look at that and say, what does that have to do with early childhood? Everything, really everything, because of the children and the families. And they need a place to stay. And in order to achieve that, they need these things addressed. So really a lot to unpack there. Looking at the resources available for early care and learning and children and families experiencing homelessness, what are some solutions? Carrie, you just named several that are that you're working on in Illinois, but what are some other solutions that you could recommend, giving the resources that are unfortunately lacking for both of those areas? That if someone is on this webinar, they're in a state where there's not even an awareness of the problem, what would be maybe be a good next step? And that's for both of y'all.
I'm happy to jump in, and then Carrie, please feel free. I've obviously everything that Carrie just described, those are all fantastic solutions and can be a blueprint for really any state. But I'll also share some examples from other states that we are particularly excited about, and maybe they'll be inspiring to folks on the call. So, in response to a 2015 legislative directive, the Oklahoma Commission on Children and Youth actually created a Homeless Children and Youth Steering Committee. And so the goal of this committee is to ensure that every child, youth, and family in Oklahoma has a safe, stable, and nurturing place to call home. And they recently developed a 2-year strategic plan that includes goals to use legislation to remove barriers for homeless families, to strengthen those cross-sector partnerships that we have been talking about throughout our conversation today that are so critical, and then to enhance that data collection to better understand the needs of families experiencing homelessness. So we are very excited about that steering committee. And then I'll also mention that in the state of Nevada, they included children experiencing homelessness as a prioritization for services within their preschool development grant. And that inclusion led to a revision of their early childhood program referral service within the state, making it easier for families experiencing homelessness to access programs. So this is something that they included within their preschool development grant, and because of that, they were able to revise a completely different system to make it easier for this population to access services. And then I'll also mention that there are a few states, including Florida, Tennessee, Missouri, they have prioritized children experiencing homelessness within their Head Start collaboration offices. And these offices have been conducting statewide needs assessments, organizing training for Head Start grantees to better understand, what is McKinney-Vento, what are the needs of children experiencing homelessness, what does the Head Start rule actually require? And I will mention that a lot of these activities require little to no resources. It's simply putting together a needs assessment, encouraging those grantees to participate, and then organizing trainings and workshops around the topics identified. And a lot of that can make such a big difference when it comes to better serving this population. Another example I'll share is that South Carolina actually created a full-time homeless support and childcare referral specialist position. So this is a full-time position that sits within their CCR&R, and this position works directly with families experiencing homelessness to help them immediately access and enroll in childcare. This has been a game changer within the state of South Carolina. And to date, this position has served over 800 McKinney-Vento eligible families and really helped not only families understand the different prioritizations that are available to them, but then those other systems too. We're thinking about, if you think about K-12, McKinney-Vento liaisons, sometimes those positions, they're overworked, they have a lot of different responsibilities, and they may not be aware that their state waives copayments, for example. So having someone whose job it is to educate systems on topics like that can really make a difference when it comes to increasing access. And then I also want to mention a great program to also look at as a model of cross-system collaboration, the Connecticut Head Start on Housing program. This program actually provides housing vouchers to early Head Start and Head Start families experiencing homelessness in the state of Connecticut. So these are families who are considered homeless under McKinney-Vento. They're participating in early Head Start and Head Start. And through being enrolled in those programs, they're receiving housing vouchers. That is groundbreaking and a really innovative program. And to date, they've been able to process 241 referrals and house 327 children, which is fantastic. And they also have a really wonderful website if you want to learn more about how they were able to bring this program into fruition. And so really it all boils down to more audiences and sectors needing to understand how homelessness impacts young children and how critical it is for these young children to be able to access early childhood development programs. And so at Schoolhouse, we really prioritize convening these systems regularly and then also developing tailored resources for all of these systems. So that, of course, includes early childhood, but it also includes family shelters, medical providers, really any system that is interacting with this population. And I know that we've been able to share a lot of those resources within the chat today. But I'm also happy to answer any more detailed questions during our Q&A portion as well.
Yeah, thank you, Sarah. Yeah, Carrie, before you jump in, just a reminder that we are going to do a Q&A after we are done with our scripted questions. So please access that Q&A function in the Zoom toolbar and go ahead and drop your questions in there. Thank you for that response, Sarah. Carrie, what would you add?
No, I don't have a whole lot to add on top of what Sarah mentioned. I agree with everything that she said. I think policy solutions and support for policy implementation is really, really important. I think what I would underscore is that, especially in the kind of resource restricted environment that we're in right now, and I think a lot of states are facing, flat and cut budgets. I think we have to keep in mind that not every effort has to be a like sweeping, transformative legislative package. I think it's perfectly okay to focus on those small incremental changes, especially if that's what's feasible to achieve. And, in fact, I think in doing that, we've had good luck, with these small wins, using that as an opportunity to build our coalition of support among various stakeholder groups to sort of bring more advocates to the table. I also think it's a great opportunity to develop those decision makers into champions around this issue when you kind of give them something that they can accomplish. I think it's really important for folks out there to do the policy analysis of all of your early childhood programs in your state, really figure out where the policy barriers are, big and small, and then, get to work to change them. Don't forget about aligning the policies across programs. I think, it is such a kind of fragmented, it's like I don't know if it's a system so much as sometimes a Frankenstein monster, that, we really got to think about getting all of our policies and expectations around early childhood homelessness aligned across our system, because it'll be so much easier to sort of deploy and really use resources and communications, sort of like what Sarah was talking about, when you have that alignment across the system. And then I just would like to underscore kind of this advice Sarah gave about those cross-sector approaches and collaborations, and just reflect that, when we were developing our 10-year plan to end homelessness in our state, or for the prenatal to 3 population specifically, it was just really striking how challenging it was to get folks aligned and on the same page. And, they really brought such different perspectives on this issue to the table, and getting to solutions that everyone could agree on was a really big challenge. And, I'll admit that it was very frustrating at times to work with our cross-sector partners, but, I think that demonstrates how easy it is for those collaborative efforts to fall apart, with under the weight of our kind of different perspectives and different push and pull that our systems experience. But, I think we realized that it is a very complex issue. It's a very intersectional issue, and trying to solve it in our silos has not been effective. So I think it's just really important for us to push through that frustration and, continue convening people to find that common ground wherever we can, and push folks to think about something new and different that maybe they haven't done before. It's really difficult work, and, appreciate everything Schoolhouse and other orgs do to convene folks. And just say too that I think having the dedicated resources and strong leadership to support those collaborative efforts is really critical too, especially if you want to keep it going for the long haul and have long-term impact.
Exactly. Yeah, sustainability, certainly. Thank you. Thank you both. I have been dropping links in the chat. I just, the most recent one is from Schoolhouse Connection, the live tracking of major actions. Sarah, do you want to tell just a little bit about what that page will entail?
Sure. So our federal policy team has put together a web page on our website, and it is a federal Major Action Live tracker. So each week they update it with what has happened across the week prior in terms of federal actions that have anything to do with children, youth, families experiencing homelessness and their access or not to education. So it's a great way to stay up to date. As we know, things move rapidly in this point in time that we're in right now. So it is a really great resource to stay up to date.
Thank you. Thanks for that. Yeah, I love a bill tracker. Always very helpful. Sarah, I'm actually going to stick with you for one of our the questions from our Q&A. I believe at the beginning you said that 48 states experienced increase. What were the 2 states that did not experience increase, and is there a theory of why? Do they have programs that might be examples for other states? Can you talk a little bit about that?
This is a great question and really put me on the spot. I want to double check because I have 2 states in mind, but I need to double check the data to make sure that I am correct. So give me one moment and I will get that information.
Sure. Yeah, no problem. Um, Carrie, I will ask you a question. There was, let's see, how do programs reserve a slot? So I guess slots that are reserved for children experiencing homelessness. I believe it was Head Start or Early Head Start that could reserve 3%. How do they do that? And what is the funding source for those slots?
That's a great question. And, Sarah did mention that there is a policy within kind of the Head Start regulations that allow programs to do this. So the funding source is Head Start. So this is specific to Head Start and early Head Start programs. And there are things written on it that I think we can probably provide you so that there is sort of a guide. But, essentially programs can just say, if I have 100 slots, I can say that 3 of them are going to be reserved specifically for families experiencing homelessness. And what that means is I don't have to necessarily meet my full enrollment requirement as I normally would. I can hold on to these slots for a certain period of time and wait for families to come to our program, or I can go out and recruit families for these slots. I think the problem that was trying to solve is that I think what we find is that Head Start is one of those programs that families are categorically eligible for, but they fill up sometimes really quickly. And so if a family comes to you just after the program year starts, they're out of luck. So I think we wanted to have a process in place so that when a slot is open in a Head Start program, it can maybe stay open a little bit longer. So it just gives the program more time to find those children experiencing homelessness and get them enrolled. But I know there's certain timelines the program has to meet. And Sarah, maybe you have those like off the top of your head. I don't, and I don't want to misspeak about what exactly the timelines are, but I know that we can provide some like written resource material for you to share out.
Well, thank you for that insight. So anything you want to say about that part, Sarah?
Well, I did find the 2 states. Sorry, I wanted to double check the data. So the states that did not show an increase were Mississippi and Louisiana, but I will say that the difference was small. So and that's something that we will track for our next iteration of the report. And if we happen to find a trend, we will certainly identify it and do some investigating to see, what could be causing that.
Right. No, that's and those were not in my possible 5 states that, that might be in that category. That's really interesting. There's a question about the Family Prevention Services Act, or Family First. Does that act have a role in addressing or preventing early childhood homelessness, and what would that role be?
Sarah, I don't know if you are an expert in FFPSA. I used to know a lot more about FFPSA. What I'll say is it really depends on, I think, your state and what resources are in that evidence-based. There's a clearinghouse of evidence-based interventions that can be paid for with Family First Prevention Services Act dollars. And I believe some states, I actually don't know if any states are using housing for that. Maybe Sarah does.
This is something I want to follow up on. I myself am not an expert, so but I'm flagging this so I can follow up.
Great. Thank
I
you.
do think it underscores, though, like the connection between our child welfare system and homelessness. And I think we see housing instability and homelessness in our populations of children who do come into contact with the child welfare system. I know for Illinois, our FFPSA program is really targeted to families in our intact family services program. And so these are families where there has been abuse or neglect has been identified, but the family has not been removed from their home. And so it's primarily focused on keeping children in the home. So I think we see a lot of overlap in these populations, and it's something to think of. I know, like from a policy perspective, I think we find that some of the interventions or some of the policies that are good for families experiencing homelessness are also good for children involved in the child welfare system. So just another thing to think about as you're doing that type of work.
Yeah, that's a good point. A question, what types of programming can a childcare provider implement that will support children experiencing homelessness? So if they get into a program, an early care and learning program, what are some things that those providers can implement to support that child and family? I'll
I
let
can mention a
either
couple of
one jump
things and
in.
then
Yeah.
maybe Sarah can jump in. What comes to mind for me here, especially if you're a state that has access to infant early childhood mental health consultation, I think that's a great resource. And I think it's really important for those mental health consultants to have training around early childhood homelessness. But I think those are professionals that can come in and provide a lot of help and support to child care programs. And then the other is, especially if it's available through your child care resource and referral inclusion support specialist or folks who focus on children with disabilities, I think can also sometimes provide some really great ideas for how to support children who might have disabilities and delays, which we see is, very common in children experiencing homelessness, or might be exhibiting, challenging behavior, which often is just trauma behaviors in children, and might also have some ideas for programs and how to support them.
Those are two fantastic ideas and recommendations. I, always want to think about flexible service delivery when it comes to children and families experiencing homelessness, and being, as open and flexible as possible. Another resource is the Administration for Children and Families developed a self-assessment tool for early childhood programs that serve children experiencing homelessness. And that is a really great resource if you are an early childhood provider and you're trying to get a better sense of how well your program is doing in these areas. It's a great self-assessment. It's a time to reflect, and it actually has links within the tool for further resources to better learn about how you can serve this population of children and families. And then I'll also mention that another great connection to make in your community are those K-12 McKinney-Vento liaisons. Even though they serve school-age students, like I mentioned, they are tasked with identifying younger siblings, and they have a lot of resources about children and families experiencing homelessness. They're also tasked with developing strong community partnerships. So if you don't already work with your local K-12 McKinney-Vento liaisons, that is a great partnership to make within your community to better serve this population.
Very helpful, very helpful. In the last few minutes, I just want to give both of you an opportunity to, if someone is on the call and would like to connect with either of your organizations to get help in increasing their support for children and families experiencing homelessness, what types of services or support could they find from your organization, and how can they get in touch? Carrie, I'll let you go ahead.
For At Start Early, I mean, folks are always welcome, to contact me and my team, and we're happy to share information about what we're doing in Illinois and some of the strategies that we've used. Start Early also has a consulting team that is available to provide support to advocates and states and other entities. You can find information about Start Early on our website, startearly.org. And my email address, I'm sure we can share out as well.
Yes, and if anyone has any questions about early childhood and homelessness, you can always reach out to me. My email is sarah@schoolhouseconnection.org, and I'm sure we can share out my contact. But Schoolhouse does federal and state policy advocacy. We have a higher education team, a K-12 team, an early childhood team. So we're always here as a resource for you. And we also have a community on Slack. This is a great way to connect with peers who are doing this work across the country, to share resources and ask questions, and also connect with all SHC staff. So I will get the link to that Slack community as well. But yeah, always here to offer support.
Great. That's really sometimes that's all folks need is just like what is someone else doing about this issue, and just something to kind of kickstart that brain, just and then ideas just flow. So yes, we will make sure that both of your contact information are included in the post webinar email. And Sarah, if you can get me that link for the Slack channel as well, we can include that. We are coming up on time. We try to end on time. There are some great questions in the chat. I think one final question for both of you. Oh, there we go. You were able to post it. Great. I wasn't sure what access y'all had. There is a question about disparities, racial or ethnic disparities in children experiencing homelessness. Can either of you address that in a succinct answer? I'm putting asking maybe the impossible there, but what, if any, disparities have been found in your experience and research?
I think we know that children of color are overrepresented in early childhood homelessness. For all the reasons that we talked about with our data, we don't have good integrated data systems. We don't have great aggregated data either. So it's hard for me to give an exact answer. But I think we do know that it's certainly an issue and something that needs to be addressed.
Absolutely. Any additional?
And I agree with everything that Carrie said. It's definitely a systemic issue with history, that certain groups of people are systemically kept out of different systems and opportunities to participate in those systems. So it's always something that we think about in terms of our advocacy and research efforts.
Thank you. Thank you both. Well, I know I have learned a lot, and I really appreciate y'all taking the time to be with us today on this webinar. I hope that our participants have learned a lot as well and gotten some great resources. Really, if this is not a topic that is kind of top of mind in your wheelhouse, so to speak, of your work with children and families, definitely some great resources on how you can learn more and educate yourself about the situation, even if it may not be something that you're directly involved in. If you work with children and families, you will undoubtedly experience it, come into contact with it at some point. And just honestly, with a 2.5-year-old myself, I can't imagine, how families are really navigating this with young children. So I hope that everyone who has tuned in today will also watch for the registration for our upcoming October Early Efforts webinar that will be on October 16th, and we'll talk about family childcare and solutions to childcare access. Registration should be coming out soon. It is right on the hour, so I just want to say thank you again to Carrie and Sarah. Thanks everyone who has joined us today, and have a great rest of your day. Take care. Bye-bye.
Thank you.